removing fat, or transferring fat.
I'm healthy, but I don't like the way I'm looking. You have those pounds where you need them to be in the curves.
Part of the body that somebody's been trying to fight for a long time.
How can you work out there, doctor,
Right.
saying like, please help me out?
Or sometimes they're doing a lot of squats, but then
Yeah,
the
of course.
muffins, you know, are still showing.
They're stubborn, those muffins.
I'm gonna be conscious, right?
Yes, all the time.
This is just a treatment to take a little fat from one part and put in the other. We're continuing conversation with Dr. Christian Farhad,
Thank you,
and
guys.
I'm a voice of so many, not only women, because you had friends of ours that were coming to your clinic, male, like men who were thinking about their kind of beauty. But the beauty subject goes on and on and on, and it has so many names. And I know with aging process, everybody's thinking about the best recipe, the best method of making themselves prettier, healthier, looking good, looking younger, to rejuvenate, to regenerate. Whatever word we use, it has to reflect our presence.
Of course.
And we're meeting here today, and I'm so delighted to ask you all the questions that I'm being asked. And because we're getting a little bit out of the pandemic mood, I think it's a perfect time for people who are thinking about vacation, going out, meeting someone new.
I got my vaccine, now
This-
what? Right?
What's next?
What now? Yeah,
What's
of course,
next?
I get it.
So I know you have incredible method that we've been watching you doing, which is a little bit called like lipostructure. So we can structure our body differently, reducing fat, removing fat, or transferring fat in different places. What is this about?
Well, first of all, you know, now it's basic. You were talking about now males getting into the action to trying to get
Right.
freshen up, look much younger, you know.
Creating six packs, having
Just
muscle.
imagine the couple of years we've been having, you know, economically and then health-wise. So this thing
Was
is
that-
starting to stabilize. We're gonna get to a point where you have to go back. The mask is not gonna be able to cover everything anymore. So then people are gonna start like to show signs of aging.
Retrieving happiness.
You know, all the stress that being done with this couple of years is being, you know, is just eating them up.
Stressful.
So the normal question is, doc, I'm healthy, but I don't like the way I'm looking. I need something to boost, to refresh, to start anew. What can I do? So we have different options.
Okay.
Now, one of them could be the liposculpture. The idea is to mold the figure.
Okay.
You won't lose any weight, but you'll shape it in the way you want it to be. You have those pounds where you need them to be in the curves.
And everybody has
A
it
little
on
bang,
the wish
a little
list.
bang.
Just imagine.
There you go.
Women want to get
Of
rid of
course.
their abdominal, you know, extra fatty areas.
You've been closed
They
up
wanna
so
curve
much.
their-
You're going to the
Yes.
beach and then,
They want to look
there we go.
ready.
Of
So
course.
what to do?
So liposculpture would be amazing for those patients that are in there around their weight, but they want to shape it.
Okay.
Now, those patients that are not overweight, but you know, they're aging, you know, the natural filler for the body is fat. So we do have a function for it, guys. It's
So you-
not only looking like having the tires, etc.
I would understand that you're fighting with a very stubborn part of the body that somebody's been trying to fight for a long time.
Of course.
Okay.
The idea is those healthy patients, you know, they work out, they have
Eat well.
they eat well, healthy enough, they have a good lifestyle, but you know, when
How many of us have the same issues?
of course, one thing is with clothes on, you know, and another is in bathing suit.
Right. We put the old jeans and the button has 2-3 inch
Yeah,
difference.
you know, the waist it pops over here,
Yeah.
the belt lines. It's always something. You know, it's very common today in guys. They're having issues with the pubis. You know, they drop down a lot of weight, but they remain there just a little tad of fat. And how can you work out there, doctor,
Right.
saying like, please help me out?
Or sometimes they're doing a lot of squats, but then
Yeah,
the
of course.
muffins, are still showing.
They're stubborn, those muffins.
Or
yeah.
the little bacon on the back. We can call it, we can
Yeah.
put the entire kitchen on the island.
Yeah, of course. The idea, well, once we get rid of it, that's one part of the equation. And the other one is, well, what we can do with it.
Okay.
We can even move it around. The normal filler, the natural filler under the skin is the fat. So once we start losing the fat when we drop down a lot of weight, for example, I had people that they're doubling hours in the gym that now they're open again. So they're overdoing it and they drop down a lot of pounds, but
they don't have
the
this
skin is
effect.
starting to become flappy. They're
Right.
starting to see, big signs.
They're getting older.
Yeah, they look, depressive. They look kind of sad, or other. The facial expression it's like anger. They have no. So
Of
what we
course.
can do to smooth that out?
So you
we can
put
take
the patient on the table.
with local anesthetic, completely
Okay.
safe. The guy's awake.
It's not very invasive.
No, of course not. We're
Okay.
talking about grams of
It's
fat.
not the liposuction.
No,
that
this is
people-
liposculpture because
It's
we're not
different.
throwing it away.
That's important.
We're not going to waste it in the machine, that immediately will make the fat unstable.
Melt.
It's going to melt down. It's very difficult to reuse because usually that fat you're going to reabsorb and you're not really going to get it there for the long
How
term.
many layers or colors or of fat you can have?
Well, we have from 3 to 2, depending
Okay.
the area. For example, legs have 2, upper layer or younger fat, and old fat or hard fat. They have different names for it, or structural fat,
Okay.
or maybe brown fat, depending which author you're reading. You're gonna get different areas.
Which one is easier to remove?
The lighter, the new one. Usually carbs, secondary to carbs. It's a very yellowish, very smooth in the process of getting it out. It's an in and out thing, and it's great for inherts or fat graft transplant.
So the dark one, the fat it's for ages, let's call it.
Well, you
The
have
stubborn
been
one.
you have been fighting for ages
Yes.
with it. Just imagine
But
how
it's
much
removable.
fibers it had inside. It's hard tissue. It's old tissue with bad circulation, so it's not pretty good to have that on the face and the cheekbones, for example.
So which one goes as a filler?
The new one, that it's
Ah.
shiny, brand new, good, new circulation, and it's gonna stay the longer because I can put whatever fat you want, but after a month, 2 months, 3 months, the old one is gonna start to reabsorb. In around 4 months' time, you're gonna look the same.
It's gonna be the same process.
So it's a rip-off. So
Right.
that's a very common thing that usually we don't explain to our patients. So you have to be very careful. You have to choose the site of donor.
And I would imagine that it's a very safe method only because I'm particular about going under a knife.
I would be too.
I would never
Of
do
course,
it.
and the full
and I
anesthetic
know a lot of
effect.
friends, they're always looking for a very non-invasive solution. But going with the transfer or removing the fat, is it safe or easy for the adaptation of the
Yes.
yellow one?
Well, if you're only using grams, remember, we're not talking pounds and pounds
Right.
and pounds because you're only molding and you're only filling. How much you're gonna need? Maybe 40 grams,
Okay,
30 grams,
right.
20 grams. The chin, for example, you can get the contour of the chin. You can
Right.
have slim down maybe a little bit the cheekbones. You can have only the filler here, those anger lines over there, or those weary and sad lines over there. Depending, you're talking about grams. So it's an in and out thing. We're talking about an hour, the whole procedure. You're awake. After you're done, you go have your meal. You can enjoy yourself.
I
It's
have
not
to
invasive.
reveal the truth about myself because I'm very honest. I came to Dr. Christian after 20 years of carrying a little bump after 2 C-sections.
I was not the one to reveal it.
No, but all my friends know I have 2 sons and it happened years ago. I'm gonna do a treatment of my life. After having 2 kids, so many unstressful clients, Yes. I'm here in Mexico, Querétaro. I'm gonna be conscious, right?
Yes, all the time.
This is just a treatment to take a little fat from one part and put in the other. That's how I call it in short.
You cannot hold the truth from spandex
Right.
and those tight pants, you know.
And I didn't
gym.
want to use too much spandex because it's
I
not
know.
comfortable at all.
I know.
But the thing is that this method gave me the ability of wearing
Bump removal.
clothes. It's a bump removal.
Now you see it. Now you know.
It's gone.
It's gone.
And it's been 2 years, and I was concerned that this is gonna come back, and it's still staying flat.
Give me your experience being bumpless.
Okay, the bumpless experience is I go shopping and I don't need to put on 20 dresses. I got 2, 3, and they're all looking good.
You love dancing. How about those
Oh my
tight
gosh.
dresses you can
They're
really
like-
use now?
You know what? This is like a little bump, and you would think it's nothing because I'm never gonna be wearing bikini in front of thousands of
But
people.
it's so
I don't need to.
sad to
But
be flat on your
but it
stomach.
feels so
You
good.
do the work in the gym, but when you have something tight on, you kind of see like you're always swollen, like or maybe even
Right.
backed up. I don't know. It's so sad.
Plus, it was like straight, bumpy, straight, and it's
I
been
know.
with me for 20 years. But now it's gone. I'm so happy, and a lot of people are asking and
Bam.
asking, "What have I done?" This is exactly what I did, and it was the best decision of my life. First of all, it was not painful. Secondly, being in the real estate business, I was able to lay down. You're doing your work, and I was on the phone doing my work. That was
How much time did you
incredible.
take to go your normal step? Because
Like-
I know I had to stop you from going sightseeing the next day, which I suggest take it easy, but you still can
I
walk
didn't
and
listen
go.
to Dr. Christian. I went to the park with all my bandage on, and
So
the
that's
Mexican
safe it
spirit
is.
took over, and I had to
Perfect.
dance. But likely
You
nothing happened.
dance. This is becoming a talk show, revealing
I
stuff.
was here
I
with
didn't
my
know that.
dad that got his health back, and I was so emotional that it pushed me to another step. I was dancing.
I have to
But-
tie you.
Right. But for anybody who is thinking about those, I call it stubborn areas, because I was working out, I was eating well. I've been doing so many things. I
Yeah, I
had
got it.
private training. It's like sometimes there is an area that you cannot poke too much because you're not gonna see the result. So this is it. But I know a lot of my friends.
But how long did it take to remove the bandages, to remove, and
know
start
what?
walking like normal?
I'm pretty capable with pain. So for me, in a scale between 0 and 10, I was able during the procedure to do my normal thing like phone calls, talking and reacting. And like you said, it's not an anesthetic that it's gonna knock you down.
We have now finished with the anesthetic procedure, the whole front part from
no idea what's behind
from the sternum to the pubis and all the sides. Do you have any pain till now?
No.
Be honest.
And I'm very honest, it was just tingling, but no pain. It was like little mosquito bites, acupuncture, needles, but nothing major. And then after, I was the person who never took the painkiller and a
Perfect.
pill and a medication.
It's very tolerable, right?
Right.
And
You
it's,
take the
yeah.
antibiotic just for the protection. You take
Because
a few
depending
things.
the area,
Right.
you could have a little sweat, you could
Right.
get a little dirty, you're moving around,
You could be
yeah.
a little bit more uncomfortable, and you wear the corset, la paja that you
and
call.
it's worth to be cautious,
But it's-
because I
it's
have some
even better.
patients, I don't know, I want to say names, but they go sightseeing, just fresh out of the operating room, but
For one day, it's still a leaking process because I understand during the procedure you put a lot of liquid.
yes,
For the
yes, to
anesthetic.
liquefy also
Right.
the fat.
So
It helped
that
me with
liquid
the
needs to
salt
leave
process.
your body. And
course.
after that, believe me, after 4 or 5 days, I felt like new me. It
One of
was
the normal
discolored.
questions they always give me is, does it come back, the bump?
To be honest,
Do you feel bumpy again?
okay, This is not a
Give us the
no,
cold, hard
no,
truth.
the bump is gone, and I know I've been using some laser. I have some gels, algae, everything natural just to keep it smooth and elastic.
Perfect.
But the bump is totally gone, and this was so hard and so unbumpable. So in that way, I just want to tell you that the discoloration went away after maybe like a week or 2 weeks max.
Excellent.
This is from poking me from both
Well,
sides.
they're 2 minor incisions, 2
And they're
millimeters.
like two little, holes that you were able to get inside. So this is almost gone.
Perfect.
And it's perfect. But we're not gonna sugarcoat the whole procedure. We want to tell the truth. So people need to understand that this is a combination. After the procedure, because I know one person who did it wrong,
I know,
and went back all the way with bad food, no exercising, the life change is crucial, and it goes together.
This is sometimes a little bit hard to understand. You think, I already had the surgery, I'm good to go. Yes, you are. But this is like removing the stock you had.
To keep
throw it away,
going.
But then if you restock, you're going to fill up again.
Right.
So eventually, after a year, 2 years, if you overdo it, you're going to get extra pounds. But still, it's hard. It's easier to slim down again.
Exactly.
But, well,
I would think it's for patients who are self-disciplined, like they're going to do it their way. With
at least a little life change.
Conscious of not.
The idea is, if you want to brag,
going
you can.
for bad choices.
Yeah.
Yes.
But, take care of the body a little bit.
So removing fat is one thing, and then transporting it into different body parts is another ability.
Of course.
It's a modulation, right?
Mm-hmm.
And that's gonna keep for a longer time.
Yes, of course. Remember, in the first week, it's like a Play-Doh. It's something that it shouldn't be there normally because it wasn't another part. And it takes time, the body, to create new blood vessels and actually retain the new fat there.
Because it's like cells you're putting into cells. Your body is adapting
but
your
no
own
blood vessels.
stuff.
The blood vessels you're going to create in the next 3 to 7 days. So that's why when they have extra gluteus, for example, or extra breast, for example, with fat transfers, it goes well, but it takes time. So you have to be wary how much time you're sitting, how much time you're walking, how much time you're wearing a bra that squeezes you, that generates a little bit the form, the aesthetic part. So you have to be a little wary the first week.
What is the most common part that people are asking you to fix?
We have 2 areas. Let's say one would be minor fat grafts, would be aging lines, crow's feet, brow, over here.
Removing or filling it?
Filling it as a filler. Mm-hmm. That'll be number one. And the other one could be the booty. Nice, round, smooth.
Hollywood style.
There you go.
In Mexico. But, so it's...
But it's different. Once we're talking face, we're talking 30, 40, 50 grams tops.
Okay.
And booty, we're talking about 500 grams for each cheek.
Okay.
So we need a good
amount
of fat to gather first, top quality.
I think it all depends on individual patients and the body structure. So I remember my friends who were trying to get a consultation. They were sending you pictures and you were FaceTiming with them just to estimate the amount of work.
Yeah, the expectation and what they wanted to have done, what they wanted to project, what area was the first, priority, and then we go down in the list.
Right. And the last thing that you offer to your patients, and it's absolutely associated with the beauty treatments, is the procedure that you do for the face. And I was the one who did it twice, like a lot of needles, a lot of stem cells inside, a lot of masks with stem cells. It's like you do it, you already feel younger. And I'm coming back to the United States, and after a few months, my skin is like screaming and missing it. So I know the weather and food and everything here is beyond belief, but on the regular basis, we struggle. We have to wake up early. We don't sleep enough. Sometimes we don't eat, the good food that we expect. So we're not going the perfect schedule as we promise to ourselves.
And
sometimes.
you don't have maybe the time to do a facial, hydrating.
Right.
You don't have the time or even want to have, one cream for this, one cream for that, another.
Do you believe in creams with stem cells? Or it's way stronger to put them inside of your face?
Everything
physically.
has its own function and indication. We have lots of stem cell based creams around, but usually they're vegetable based stem cells, and we are not vegetables. But vegetable based stem cell creams could help you hydrate a little better than normal creams.
Right.
That is true. They're gonna regenerate and you're gonna maybe feel like 15 years younger. Well, no, guys, it's just just a vegetable. You're not even near
so
in a molecular level.
What would you recommend for people who want to have this blushy, fleshy, younger effect on their skin? I know it's not a miracle, but something that is working.
How to boost the inner beauty in that skin. How to draw out the best of that face, of that skin. We usually mix different techniques. Local anesthetic, cream when you're not feeling anymore, good deep cleansing, and then we could try opening up those pores. How we can boost how much absorption you're gonna get in the skin, because it's not the same you're applying something topical that you open up the pores with microneedling. Higher percent ratio absorption rate of the skin. Makes a micropore just a couple of seconds long before it closes itself, just long enough so the active substances go in and enrich the skin. And you're boosting up to 3,000 the absorption level. So we apply different active substances to hydrate, to remove the fine lines, to remove pigmentation of the sun.
Collagen.
Exactly, to boost collagen production, elastin production. So you're gonna have, just with that, you're gonna look tighter in the skin, you're gonna look much fresher, but then we're gonna go through the facial expression, the body type, and what the patient really wants. We can go a little Botox, we can go a little PRP to regenerate the skin. Then we can go with dermal stem cells to try and boost a specific section, or try to remove those hard cases of acne, those issues with immune system related skin issues, burns, scars, etc., etc. We can put local enzymes to try and boost, remove bad fillers. We can apply good fillers. We can have PDO threads for the lifting. We have, radio frequency. We have a bunch of laser, a lot of stuff, depending on the case.
So many options that it's hard to choose.
It depends a little bit on the skin type, the age of the patient, and how much damage is there. But all in all, we can always reach a middle point where you're always gonna look, and stay younger, fresher look, but without removing your normal characteristics of your body, your facial expressions.
If it doesn't hurt, it's not gonna damage anything. It's just gonna improve it. Well, like I said, I'm asking so many questions because we're coming here a few times a year, and we're always with a group of people, and it's just making our hearts, smiling even more.
And WhatsApp crying faces. Because it's always like bursting of so many messages. Sometimes you cannot even go through them all.
You're changing their lives.
Oh,
you changed ours, and it's not only health and beauty, but they feel stronger, they feel healthier, and they are motivated to keep going that good path. And I think that's the most important.
This is just a big push. But once you open the door and you look better, it's much easier to say, you know what, I'm gonna eat better. You know what, I'm gonna try a little harder to drink a little extra water. I'm gonna buy that cream to maybe, pamper myself. I'm gonna get that dress. I'm gonna get that gym subscription,
We spend so much money on things that don't matter. And if you invest into yourself, and if you do those little natural, looking changes, you feel just fabulous.
Of course, we usually forget that we are very visual. You look better, you start to feel better. even though if you're feeling very down in the deep side because you're not happy with the whole situation, every day you feel much better. It's easier to actually, you know, grab the strength to start something new. And this could be, you know, maybe the excuse for a new you.
Right.
So it's worth it.
So whatever we eat, that's how we look. And with all the additional changes from Dr. Christian, I know a lot of women in Illinois are walking already with very stretchy, beautiful clothes. They're going with full confidence vacationing and showing the bikinis. And men also reducing here and there, whatever it's unwanted. But if you have any questions, I think we're gonna meet with Dr. Christian many times. And the plan is even with the group that is coming soon. Perfect, because everybody wants to touch a different angle, and everybody's different. So we're gonna try to get the recipe
bit by bit, and hopefully we'll eventually have all the different takes. So try to keep in touch.
And are the patients allowed to have a glass of wine? Being in Cancun, it's a perfect spot to do it.
You know, one glass of wine has antioxidants, and it helps you with blood flow circulation. So
just benefits, nothing else. Thank you so much. You know that we love you, and
thank you for taking the time and listening to me. Thank you so
not
much.
that I'm trying to throw you all the compliments, but transforming the bodies and health of people means more than any word that we can express today trying to explain how it works. You just need to try it. You have to have a willing to make those changes and continue a good vibe in your life. But thank you so much.
No, you're so welcome, and whatever you need, I'm here for you.